Hi, Dr. Ramsey Choucair, a board-certified plastic surgeon in Dallas, Texas. And many of you know that the pandemic that we've experienced for the last 6 to 7 months has changed many things, many lives and many businesses and many practices. And as far as our practice in plastic surgery, I'm trying to update you now, little past the second week of August in 2020, about where we stand on COVID in our practice. Many of you have said you appreciate the guidelines, and hopefully this will be helpful. So first of all, we are still taking every precaution in our office with cleanliness and disinfection, much that we did before COVID, just being even more fastidious about it, more obsessive. I think patients, are all wearing masks in our office unless we're looking at their face, and if we do look at their face, of course, we're wearing masks as the employees and the physician in the office. So we want patients to know that we're cautious, and we want patients to know that we care that they be cautious around us for the benefit of all our other patients. So the question comes down, now that more people have had COVID, when can someone come back to the office and have a procedure or be seen after they've had COVID? And the current CDC guidelines and guidelines we're following as of now are this. If a person has had COVID and it's been at least 10 days since their first symptom, and it's been at least 3 days that they've had no symptoms, that's the point that the CDC says they are able to go back into society, and we would be able to see them. We may give it a few extra days if they're having surgery. We are still COVID testing every patient. However, if someone has already had COVID and they've already followed those guidelines, 10 days since their first symptom and 3 days with no symptoms, the CDC says there is no reason or benefit to test them, because they could test positive for several weeks or months, but it doesn't mean that they're infectious. So that's the current state as of now, the second and a half week of August. I hope that helps you understand what we're trying to do to keep people safe, and I think following the CDC guidelines is the best information that we can have. Hope that helps.